part of the reason this meeting is such an important part of what we do at the AHA is we recognize the energy that can come from bringing people just like you together to help create new solutions. So a bit about the American Heart Association. The AHA has been saving lives for over 90 years. The association was founded by medical doctors interested in finding cures and treatments for heart disease, and we've evolved over time into an organization that really focuses on making an impact. And the work of the American Heart Association in this decade is guided by our 2020 Strategic Impact Goal, which focuses on improving the cardiovascular health of all Americans by 20%, while reducing deaths from heart disease and stroke and other cardiovascular diseases by 20% during that same time period. And this is more than a slogan or more than a set of numbers. This is really what drives everything we do at the American Heart Association, is thinking about how our solutions can have an impact on people's health today. This improvement in cardiovascular health is really an important focus of the organization. If you look at all causes of mortality, and these numbers come from the CDC, and these would also be the same numbers globally. If you look at the leading causes of mortality, you would see dietary risk, high blood pressure, tobacco smoke, air pollution, high body mass index, and high blood glucose right at the top. And so these are all things that are important to the American Heart Association and areas of focus, because when these numbers are in an ideal category, they help people prevent their risk of cardiovascular diseases and also many other diseases like cancer, of course, as well. And when we think about what makes the American Heart Association different as an organization, under the umbrella of the AHA, we have many different things that we do. I'll start by talking about the science of the American Heart Association. The AHA has, as part of its complement, 33,000 science volunteers who create the science membership arm of the AHA. And these science volunteers, many of whom represented in this room, like Drs. Peterson and Harrington and others, are specialists in their area, and they span a wide range of specialties: cardiology, neurology, basic science, epidemiology, nursing, outcomes, and it's through this volunteer complement at the American Heart Association that much of our scientific work gets done. The AHA also has a very large grassroots presence. We have 33.5 million volunteers and supporters in this country that work on behalf of the association in communities every single day. These volunteers are advocating for system change in their community. They're implementing programs of the American Heart Association. They're helping to make their hospitals healthier. They're raising money for the AHA. And so this wide, broad band of people who care about the association and our mission really is an important part of who we are and what we do. And then, of course, the Heart and Torch, the brand of the AHA, positively recognized by over 90% of the American public. And so, the combination of our science, our brand, and our grassroots really provides the association a wonderful platform for creating new innovation and new solutions. In terms of what we do with the money we raise, we've funded $3.7 billion in research since 1949, but perhaps more important, these data show the impact of our research program in a 7-year period from 2008 to 2015. And just to give you a sense of the magnitude of the reach of the AHA, during that 7-year period, we funded 7,900 research awards for over $1.1 billion at 438 institutions in the United States. Of those scientists we funded, there are over 400 active patents that are pending, 30,000 publications that resulted in almost 500,000 citations in peer-reviewed journals. And the collaborations across institutions is something that's really important to the association as well. And this is why we have expanded the research program of the AHA in a number of very important and meaningful ways in the past several years. First of all, we have created what we call strategically focused research networks, which are groups of scientists and researchers at multiple institutions working to solve really key problems. So for example, we have strategically focused research network in heart failure, in women in heart disease, in stroke, in prevention, in hypertension, and in health disparities. And in each of those categories, there are 4 or 5 institutions in this country that are collaborating together to work on various aspects of research related to those topics. And they span basic science, clinical science, and outcome science, all within the center. And so we really believe that focusing these research programs in this way can make a big difference in accelerating outcomes for patients. Each of these topics are funded at around $15 and in some cases $20 million. So the association has put significant resources into investing in these centers. We've also more recently invested significantly in creating the association's Institute for Precision Cardiovascular Medicine, which is a very large focus of the association. We've created this institute both by hiring people on the staff of the AHA who are experts in genetics and data, as well as by creating a robust grant portfolio to bring people together who are thinking about precision cardiovascular medicine and health. We are doing a number of really important, very cutting-edge things that we'll be talking about more in November at our scientific sessions meeting, but things related to how patients will be at the center of research moving forward and how we can foster an environment where data can be shared more actively among and across research studies and people who own specific data sets. But this is a big area of investment for the association and an area that we think many of you might be interested in partnering with the association on, because especially as we think about the patient research network that we're creating, there's lots of opportunities for sensing and monitoring devices and other types of things that will be important to finding answers that we seek. We also more recently announced One Brave Idea, which is a collaboration between the American Heart Association, Verily, and AstraZeneca, where we have funded one leader and one team who we are counting on to find a cure for coronary heart disease. This leader and team will be announced on October 5th, by the way, and this is a worldwide team of people led by an individual who will be well funded both with dollars, 75 million of them as a matter of fact, as well as with resources that are provided by the American Heart Association, by Verily, and by AstraZeneca to really push the paradigm of how we can create faster answers, more innovation in science, and more of an opportunity to bring together people from multiple disciplines, not just multiple scientific disciplines, by the way, but people who think about work, bioengineers, people that do physics, people that are experts in mathematics, other kinds of things, all part of one team to help us find a cure for coronary heart disease. So that's a big focus of the organization now as well. The other thing important to note about the AHA is with our partners, we create the standard of care in the United States for many of the risk factors and disease states associated with cardiovascular disease. Using the best evidence and our very robust evidence generation and evaluation process, we write guidelines and publish statements as well as policy positions that really become part of how care is delivered and what becomes a social norm in this country. And to give you the scope of the work, in 1 year, we are on a fiscal year, July 1st to June 30th, in one fiscal year, the association published 49 new guidelines and scientific statements and 19 policy statements. And so these, again, are very important part of the work of the AHA and really part of the science engine of the American Heart Association. And these statements and guidelines and policy position statements are foundational to all of the work that we do at the AHA. So any program that we enter into, any relationship that we have, any expertise that we provide, especially to individuals that are innovating new solutions, will always have at the foundation the science position of the American Heart Association or the policy position of the American Heart Association. And certainly the AHA represents the voice of the patient, and we do this by bringing patients together, in a public policy and legislative way, but also to engage patients in their care and to make sure that the way society thinks about patients and care of patients is most appropriate based on best evidence. And I wanted to give you just one example about the reach of the American Heart Association's work with patients. And within the past couple of years, we've created a patient support network that is driven to allow patients an opportunity to interact with each other after they've been diagnosed with a certain disease state or risk factor. And in a short period of time, you can see the growth of the enrollments in the patient support network. Now 56,000 patients are actively enrolled in this network, and we're working very diligently to make sure that they have an opportunity to fully engage in the work of the American Heart Association, whether that's based upon their interests and their desires, but certainly based upon the breadth of opportunities that the AHA can offer them. The other thing important to know about the American Heart Association is we really focus on the entire life cycle of an individual, from young children, where we're thinking about standards for daycare centers, we're thinking about pregnant mothers and what prevention needs to happen at that point, all the way to young children, where we focus actively in communities to make sure that schools are providing the healthiest opportunity possible, and that we're changing the environment around interactions with kids in schools and in their communities, through adults, and certainly all the way to end-of-life care. And I'm going to come back to you on end-of-life care in a moment. But at the bottom, you'll see the platform of the AHA, which are the 7 health factors and health behaviors that I mentioned early that help define ideal cardiovascular health. So what are we thinking about throughout this entire life cycle? We're thinking about getting people to eat better, get active, lose weight, quit smoking, reduce blood sugar, control cholesterol, and manage their blood pressure. These are the focus areas of the AHA throughout a person's life cycle. And to make sure that you're aware, the AHA, even though we are the American Heart Association, also has a large and robust global impact. Throughout the world, the AHA has a presence in 70 countries. Much of this is driven by our work in emergency cardiovascular care, so first aid and CPR. The AHA convenes the International Liaison Committee on Resuscitation that writes international resuscitation guidelines, and then we very quickly, through the work of the AHA and our operations, are able to create a network of training materials and technology-based solutions for training, not just for healthcare institutions, but also for the lay public. And it's through this work that we have this presence by certifying training centers, not just in the US, but internationally. And we have 716 of those, who in essence are kind of like franchised business units of the American Heart Association, delivering our solutions worldwide. Our Go Red for Women campaign, which is focused on women and heart disease awareness and action, is present in 56 countries as well. And the AHA actually has a physical office presence, if you will, in 7 countries, in addition to this network presence in over 70 countries. I wanted to make sure that you know beyond the things you might know us for, we have several new areas of emphasis at the association. We've most recently created a Center for Health Metrics and Evaluation that will be focused on creating the science behind measurement and evaluation, not just of what we do at the AHA, but of things being done in the community more broadly. We also have created a new emphasis in peripheral vascular disease, which is a major priority of the association. We held a thought leaders meeting last August, and we have a white paper really defining the areas of priority for the association in peripheral vascular disease in the future. We're very focused on brain health and healthy aging. Certainly, we recognize that the risk factors for traditional cardiovascular diseases are very much in line with the broad spectrum of brain health, not just stroke, and so this is an area of emphasis for the AHA. And we've created a new workplace health solutions business where we're taking the programs and the technology solutions of the American Heart Association into companies across America and using the brand and the grassroots of the AHA to really provide this leverage. As an example, we did a pilot at the end of our fiscal year in May and June around a new index and awards recognition system for companies that have created not just a healthy environment, but have data to show actual improvements in the health status of their employees. And in a 12-week period, we had 560 or so companies sign up, and we'll be fully launching this new awards and recognition program in January. The other thing that I would do before I turn it over to Dr. Peterson is just put a challenge back out to all of you. You know, we see some areas that are very important to the mission of the AHA, and as best as I can tell, they're very underdeveloped and an opportunity. And certainly I know for all of you in the room, we need to create a market that is looking for these solutions, but I want to at least plant the seed with you. You know, first of all, there was a nice discussion last night around whether technology creates more of a divide in terms of the haves and have-nots, or whether it's a way to bring people together and provide solutions to the billions of people worldwide who have access to cellular mobile technology. And I don't think we actually know the answer to that, but we need to figure it out. This is a Robert Wood Johnson Foundation map of the city of New Orleans, and it shows the life expectancy of people who live within a 5-mile radius. You know, you see right there in the heart of New Orleans, the life expectancy of individuals there is 55 years old. And you go up the street to the 7th Ward and you might gain 11 years, 66 years old, down over to my left, 71 years old, and then you go up, just a few miles away and people are the life expectancy is 80 years. That is not okay. It's not okay with us at the American Heart Association, and we feel like that there has to be a way not just to change the environment around people and to help create healthier communities, but to think about how technology can inspire new solutions for these individuals who now, have a life expectancy that is not acceptable, 55 years old. Another thing that I would say is that as we are thinking about investing in creating new technology solutions, there are people with a lot of money who are creating technology solutions that are working against us. Isn't this an interesting iPhone-looking device here? This is have any of you seen this? Do you know about this? This is a $3 billion investment that Philip Morris has made in creating IQOS. iPhone, IQOS, right? It's being marketed right now in Japan and Switzerland, and they're looking to figure out their path to an FDA approval for this new device. This is a tobacco heating device, so it's not a cigarette, and it's not an e-cigarette, but this is a stick where you put a classic cigarette in the end of it, and it heats the cigarette instead of burning the cigarette, but you still get all of the taste of the nicotine and all of the bad chemicals still get within your body. And the marketing approach that Philip Morris is using to try to crack sophisticated markets is amazing. So this looks like an iPhone, it plugs in like an iPhone. They have announcements. So this is the head of the IQOS division of Philip Morris up here on the top left announcing this new product, just as you might expect an Apple announcement to happen. They have these IQOS stores in Japan where they have people that are very similar to the people that you might come across if you walked into an Apple store. And if you look at it again next to an iPhone, this is exactly the image that they're trying to create. And so we have to recognize that the need for us to move more, faster than we're moving now to create solutions. We've got to outsmart the people who have money and provide these solutions. The last call to action I would talk about is for end-of-life care planning. As we think about helping to change the dialogue on dying in America, there was a wonderful IOM report called Dying in America. If you haven't read it, it was published 2 years ago, and it's a beautiful, well-done piece about needing to change, the entire way we think about dying in this country. There are no technology-based tools of any scale that help people think about things like advanced directives, conversations, and there's a big movement afoot, 120 organizations, prominent large organizations, including the American Heart Association, working through the Coalition to Transform Advanced Care that are thinking exactly about changing payment models, changing in-hospital and healthcare system models for how these discussions happen, public awareness campaigns. So you're going to see more and more about this, but there are not good technology-based solutions that need to be developed to allow this to happen more seamlessly. And so I would give that to you as a call to action as well. And then finally, I would just say that for us at the American Heart Association, because of our focus on content, because of our focus on creating the standard of care through our science, and because of the opportunity to leverage the brand of the American Heart Association in relationships with amazing people like all of you, today I announced that we have created and launched our Center for Health Technology and Innovation. And this center, led by Patrick Waite on our staff. Patrick, you all know Patrick, but wave around. And Dr. Eric Peterson, who's going to be coming up soon as our lead volunteer champion. You will see the AHA continue to create new solutions in this space and to focus on how technology and scientific innovation can really make a difference in the lives of people, not just here in this country, but throughout the world. And so with that, I thank you again for being here, and I will call up Dr. Peterson to talk to you a little bit more about the AHA's work in health technology. Thank you very much.